Good morning. I'm delighted to be with you here talking to you about you and your business. Well, you know, Obamacare, which is something that I just never thought was going to happen right from day one. I just believed one of the many obstacles and hurdles that was thrown at it would eventually bring it to a halt, and alas, it did not. And, I'm just in shock over the situation. But there's others that are out there who are going to continue to fight on. And, of course, any opportunity I can help in that fight, I'm going to take advantage of. There's an interesting organization out there called Obamacare Watch. You can learn more about them at ObamacareWatch.org. It's a project of economic policies for the 21st century, which is a great group that's been on the program several times before, and always delighted to get spokespersons from there on this show. And James Capretta is with us. And James, you're the director of that project. Welcome to the program.
Thank you. I'm glad to be with you.
So tell us a little bit about the project to really, I guess, not only put up a good fight, but also provide important information that everyone needs to know when it comes to Obamacare that I think clearly they don't know. And what really bothers me most, James, is that it sounds like there's been a lack of effort. You're not the only one who's been trying to tell people this is what Obamacare is going to do, but education's crucial, isn't it?
Yeah, no, it's been a multi-year effort to try to do this, and there's some frustration involved in the sense that we're still fighting, but you got to keep going here. And our project is to make sure it's a public education effort. It's to make sure that all of the information that is out there and done, research, analysis, commentary on the law and what it will do to employers, to physicians and how they provide care, to patients and the kind of care they receive. All of that information is organized in a very accessible and easy-to-use website, ObamacareWatch.org. So users can go right to it and find out pretty much anything they want to know about the law from that website. And so that's why it was started. We also, of course, do lots of public commentary. I'm in addition to working for ObamacareWatch.org, I'm a senior fellow at the Ethics and Public Policy Center and a visiting fellow at the American Enterprise Institute, and so I do a lot of public commentary, writing and speaking about the law and the alternatives to it as well. What could be done that would work better? Yeah,
very good organization. I'm good. Have good memories of working with some of the people there at the center, and it's a good organization. So talk a little bit about this Obamacare Watch. One of the things that people have already begun to see, even without full implementation, has been a big jump in their health insurance premiums just right from the very, very beginning. And I guess a lot of it has to do with the fact that if your child is able to sneak in and get coverage without disclosing any, health issues, you can't take them off the insurance. That adds to the risk factor for an insurance company. Insurance rates, I don't think people realize it, they're predicated entirely on risk. It's risk management is what insurance companies are actually in. Another thing is raising the age in which someone can be on health insurance. A dependent now is in his late 20s with under Obamacare. Those are a couple of things that have already begun to happen immediately. But you're saying, and there's over there at ObamacareWatch.org, quoting the Aetna CEO, seeing Obama health law doubling some health care premiums. Talk a little bit about that.
Yes, when the law's main provisions kick in 2014, there's going to be quite a bit of sticker shock for people that are currently insured in the individual and small business insurance marketplaces. So people who work for small businesses or buy insurance on their own. There are many millions of people in that category, those categories, who already have insurance, kind of like their insurance today. Well, they're going to be seeing very large premium increases in 2014 because the insurance that they're getting today will now be pooled, as you indicated in your comments, with many other people who currently aren't in that marketplace today under the new law. And so you're going to have a risk profile for all the people that are being pooled together that is less healthy than today's risk profile. And so the premiums for the entire group is going to go up by quite a bit, probably on the average of about 25 to 30% in some parts of the country. Mm-hmm. The large insurers have been warning about this for the last 3 years. Candidly, the Obama administration has tried to suppress this information and pretend like it's not going to happen and sort of, sweep it under the rug. But it's quite clear that there's going to be a pretty big premium shock in 2014.
Yeah, no question about it, and I think it's only going to go up every year. And I have a prediction. I like to play with you a little bit on it. In England, our healthcare law is more like the England law, the British law, than the Canadian law. And in Britain, you are allowed to have private insurance. You're still allowed to maintain private insurance, but roughly less than 10% of the population actually does that. 90% are on the government healthcare program. And my prediction is, what was interesting about that number, that's about the same number of people in the United States that have their kids in private schools. About 10% of the parents have their kids in private school. I think the people who end up, I think you're going to see a similar percentage over time. People who will be on government health care, which, only gives you peace of mind, but probably won't actually work when you need it. Just ask the Canadians. But a very small minority actually owning their own private insurance. What do you think about that?
I think you're probably basically right. I mean, it'll take a little while to evolve to that point.
Oh, it'll be years like it was in England, but yeah.
Yeah, it'll take a little while to evolve to that point, but I think you're basically right that if this law is implemented as currently written, there will be a movement, gradual and then perhaps accelerated at some points, toward pretty much government consolidation of control of the health system, and employers will slowly get out of the business of doing it themselves. There will be a remnant private insurance system that's outside the governmentally managed system, and that'll be large at first, but it will shrink over time. And it's just the nature of these things. When the government becomes the dominant player in any sector of the economy, it squeezes out private activity. It makes investment in that marketplace by private actors less attractive and also more risky, right? If you're a private business,
yes,
and you say, hey, maybe
you're going to have a level of liability that the government will never have. The government goes and cuts off the wrong foot, and it's like, oops, you do it. You know what? You may lose your ability to practice whatever the deal is. I mean, it's hard, and it's also hard to compete against, quote, free healthcare.
Right, exactly. Yeah, no. So it's the nature of these things that when the federal government, gets involved, that it squeezes out private activity and makes whatever private sector marketplace did exist shrink over time. So I think your prediction is probably spot on.
With a minute left, what are some battles you guys are fighting or encourage people in the fight? I know you're a .org, and so you really are a more on the think tank side. But what battles should we watch?
Well, look, I've written with others that the front line here is at the states at the moment, that the federal government is relying very heavily on the states to implement two aspects of the law, a very large Medicaid expansion and implementation of what are known as the state exchanges. Thus far, only 18 of the 50 states plus the District of Columbia are implementing the exchanges, and more than 31 or 32 are refusing to do so, at least fully. So that's a good sign. It means that the federal government is not getting the states to do its bidding, really, at the state level in terms of implementing the law. I think that gives the states a lot of leverage to come back to the federal government and demand changes in the program going forward.
Hey, I got to wrap it up. Thanks for being with us. And you know what? For those states that are controlled by Democrats, I hope that becomes a battle cry, a referendum going into the next time they're up for re-election. James Capretta, he is with several different groups, but ObamaWatch.org is what we're talking about here today. Thanks for being with us.
You're welcome. Thank you.
All right. When we come back, we're going to have much more for you. Stay tuned to it right here on The Price of Business.